We want to welcome back Michael Maron, who is President and CEO of Holy Name. Hey, Mike, good to see you.
Good to see you, Steve. Thanks for having me back.
Hey, Mike, listen, as we do this program late September, there was just an article, I believe, in NJ.com/The Star Ledger, a detailed article about the vaccine mandate in most healthcare systems. And by the way, Holy Name, one of the many healthcare organizations that support what we do. All of them, as I understand it, have a vaccine mandate, but there was an article, the article talked about the connection between the vaccine mandate for healthcare workers, particularly nurses, and the shortage, the staffing shortage of nurses. Please talk about that and help people understand why it's so real.
Well, so put vaccine controversy aside for a second. COVID burnout has caused an incredible shortage of personnel in all the hospitals. And so when you're looking for talented nurses now, and you're looking for the caregivers that are absolutely essential to make any of our organizations run, they are in very, very short supply. COVID has given people a reason to do a reset and a rethink about their entire career, their life path, and people are leaving the profession. They're tired, they're burnt out. You throw on top of that now the complexity of a COVID mandate that
a vaccine mandate.
Yeah, vaccine mandate. Yes, I'm sorry. That just adds another level of complexity for the few people who don't. Now, Holy Name, we're blessed here. We have a 89.6% vaccine rate amongst our employees. And in that mix is the 11%, 10.4% who are not. A majority of them really don't work here. They're per diem employees who work somewhere else. And their paperwork just hasn't caught up with them. So we suspect that the actual true vaccine rate here is significantly higher. So we don't have the problem with our existing staff. I absolutely have the problem with burnout. And I absolutely have the problem with now trying to recruit in the right mindset person who's gonna fit into Holy Name's culture that defines who we are.
Mike, I'm going to ask you about Haiti in a minute, because Holy Name and Haiti, and you directly very much connected to Haiti and the crisis, the multiple crises there. But I just want to follow up here. You've just said many times about the COVID burnout. What exactly are you and your colleagues doing, but more importantly, the larger healthcare system? What needs to be done for healthcare professionals and the burnout they're experiencing? What do they need?
So a lot of them, we've been offering support and counseling to people that saw the tragedy. A lot of it is just inner fear and anxiety. So every day you're coming to work, especially in the emergency room, where you don't know who's walking through the door. And so the risk levels and that fear factor is as high as I've ever seen it. Right? Most people, most of the nurses, the physicians, the staff who sign up to work in an emergency room, they like that excitement. They like the unknown. They like the fact that no 2 hours are the same, let alone 2 days. And they thrive on that. But this has been a consistent drain, an emotional drain, where people start to think, hey, I'm putting myself at risk. I'm putting my family at risk. When you start to see vaccine breakthrough cases increasing, and people are wondering now, like in challenging questions, is the vaccine really all that helpful? Because we're seeing a significant increase in breakthrough kind of cases. So
what do you think, Mike? Because you had COVID very early on. For those who say, come on, people are still getting it who had the vaccine. I have the vaccine. I worry about it. But Mike, isn't it also fair to say that the level of illness and the seriousness of it is very different for vaccinated versus unvaccinated as a non-clinician?
Correct.
Which I am. Go ahead, Mike.
Yeah, so let me put it to you this way, Steve, and I always try to keep it simple and to the point. In all the thousands of people, tens of thousands of people with COVID that we have treated and successfully treated, and the ones we've lost and died, vaccinated or not, it was COVID that killed them. We have not had a single admission, a single case related to someone having an adverse reaction to the vaccine. And so as someone who had COVID and someone who's fully vaccinated, I tell you, and I tell everybody who's listening, the risk of getting sick and dying from the virus is significantly greater. So the vaccine may not be perfect, but it absolutely helps. And you need that every ounce of help you can get.
But Mike, let me clarify, you got COVID pre-vaccine, correct?
Pre-vaccine. I was early on. I was March 2020.
Believe me, I remember we're about to tape and it was happening literally at that time. Hey, Mike, help us on the cutting edge technology, standardized vaccination verification. What do we need to know about this?
So it's important here in that I think it's important for people to be able to have a secure vaccine record that's portable, that they can take with them. This is not going to go away. This is going to be a new norm. It could be for the rest of our lives, definitely for the next 5 years. So the ability to be able to call up your vaccine record on your iPhone at a moment's notice, not worry about where the paper card is, to us is essential, right? It's just going to be part of life. And so we designed and developed software to do that. We partnered with a company that's based in Switzerland, but also has offices in Virginia, SCIPA, SCIPA. They are software security experts, and we put a blockchain security on it. So you don't have to worry about your personal information ever being hacked into or displayed erroneously where it doesn't belong.
Hey, Mike, do this. Got a couple minutes left. Haiti and Holy Name, yourself. I always ask you this. How many trips do you think you've taken there?
Well,
dozens and dozens and dozens.
Yeah. Typically, I go every 6 weeks.
And Sakakur, if I said it correctly, there's a hospital there.
Yes.
That you and your colleagues key to building, running. Question, the situation in Haiti, describe it from a healthcare perspective, A, and B, what should the rest of us need to know and potentially do to be helpful?
So Haiti, obviously suffering a lot. They have the political unrest. They had the earthquake again. Thank God, nowhere near as devastating as the one of 2010. And COVID has run rampant through the country. It is currently, like everywhere else, it's on a downtick. So when you look at the COVID waves, every country, as poor as Haiti to the wealthiest United States, and then state by state in the US, we all go through these cycles of peaking of cases, and then they precipitously drop off. So
by the way, we're taping on the 28th of September. Mike is not saying what it's going to be 3 months from now. It's where it is today. Go ahead, Mike. I'm sorry.
Right. So Haiti now is on a downturn on the number of cases, people presenting. It doesn't have the sophistication that we have or any other developed country has in terms of accurately tracking it. But I know from a daily census, so we went as high as 25 people a day being in the hospital with COVID to we're back down to 3. So it is not as prominent in the community. It is taking that turn. We don't know if it's going to uptick again, but at the current moment, it's at its lows.
Answer the last part, Mike. What can people do? We'll put up your website, but also Jackie, our executive producer, make sure there's a Haiti connection so if people want to be helpful. Go ahead, Mike.
Yeah, so if you want to be helpful, the best way to do it is go to holyname.org. We have a whole section on our website around our hospital in Haiti. It's a 200-bed, one of the most advanced hospitals in all of Haiti. 200 beds treating 2.5 million people, to put it in perspective. And so financial donations, anybody who wants to volunteer or help, we welcome all of it. You can sign up. You can donate right there on the website. We appreciate any support we can get.
And by the way, as we leave this segment, there have been many physicians connected to your team who have gone there again and again and again to try to make a difference in a country that has experienced, it's not fathomable, at least to me, the degree of devastation and pain and heartache they've experienced. Hey, Mike, thank you for joining us.
You're welcome, Steve. Thank you.
Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Johnson & Johnson, NJ Best, New Jersey's 529 College Savings Plan, the New Jersey Board of Public Utilities Clean Energy Program, Valley Bank, the New Jersey Economic Development Authority, Summit Health, the North Ward Center, and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications and by the New Jersey Business and Industry Association.
What is your child's dream for the future? Doctor? Teacher? Architect? Whatever they aspire to be, a college education may realize those dreams. And NJ Best can help. It's the college savings plan specifically designed for New Jersey families. Start saving today with as little as $25, because now is the time to invest in their future. To learn about NJ Best 529 College Savings Plan, its investment objectives, risks, and costs, read the Investor Handbook available at njbest.com.